The human heart has 4 valves, and keeping them healthy is crucial. Heart valve disease, which can develop quickly or over a long period of time, affects more than 5 million people in the United States. Heart valve disease can cause serious health problems, but knowing risk factors, symptoms, and treatment options are key for long-term heart health. Thanks for joining us for Health News You Can Use. I'm Dan Cohen. Joining us is Dr. Adnan Chhatriwalla, an interventional cardiologist at St. Luke's Mid-America Heart Institute. Dr. Chhatriwalla, thanks for joining us during Heart Month.
You're welcome.
I want to start with heart valve disease. How does it differ from traditional heart disease?
When people think about traditional heart disease, they're usually thinking about cholesterol buildup in the heart arteries, coronary artery disease that leads to heart attacks. When we're talking about heart valve disease, we're talking about disease involving one of the 4 heart valves that let blood through the different chambers of the heart and out to the body. The most common valve problem that we see is aortic stenosis. It comes with age and wear and tear. And in that situation, the aortic valve doesn't open well enough to let blood out to the body, and the heart has to work harder. The aortic valve can also leak, but that's less common. The second 2 most common valve problems are mitral regurgitation and tricuspid regurgitation, when those valves are leaking blood backwards. And the third most common is the pulmonary valve, stenosis or regurgitation, which we often see in patients born with congenital heart disease that have problems later on when they're adults.
Our Valve Center for Excellence here at St. Luke's is doing a lot of work in this area. Can you tell us about what the team is doing right now?
Yeah, so it's a great collaboration really with the surgeons and the interventional cardiologists. When people come to our multidisciplinary valve clinic, they will see a cardiologist and a surgeon together, hopefully have all their testing done and be able to walk away with a plan. Many patients still need surgery, especially if they're younger, but many of our patients are in their 70s, 80s, and 90s. They're not great surgical candidates, and that's when transcatheter, minimally invasive procedures may be what's best for them.
I want to go back to heart valve disease and the symptoms and risk factors. Can you walk us through some of those? Yeah,
absolutely. So the most common thing we see is shortness of breath or fatigue, not being able to do the things that you're used to doing, not having the energy. But some people, fewer people can get dizziness or passing out, palpitations, irregular heartbeats, or even chest pain.
The Valve Center for Excellence, there have been a lot of advancements recently that you guys have accomplished. Can you walk us through some of those?
Yeah, it's been a great journey. So we started transcatheter aortic valve replacement in 2008. We were one of the first 20 centers in the country to do TAVR. And then that led to approval. Now we do more transcatheter aortic valve replacement in the US and in the world than we do open heart surgery. And so that's been a great journey. We were part of one of the first mitral valve trials that led to approval for transcatheter mitral valve repair. And now in the last year, we've completed enrollment in 2 tricuspid valve trials that have led to approval of 2 different devices for tricuspid regurgitation just in the last year. The first is called TriClip. That's a transcatheter mitral valve repair. And the second is Evoke. That's a transcatheter mitral valve replacement.
That's so fantastic to hear about all these advancements you guys have been making. And I want to go into the timeline between minimally invasive procedure recovery and traditional open heart surgery. What's the difference between the 2?
Yeah, it's a night and day difference. So open heart surgery may keep somebody in the hospital for up to a week, and then they might take 2 to 3 months to recover until they're really fully back to normal. Yeah. With our transcatheter procedures, most of our patients will go home the next day, take it easy for a week, and that's really it, and they're recovered.
That's amazing that the difference is so stark. And structural cardiology works hand in hand with these diagnoses. Can you tell us about what that team is doing here at St. Luke's?
Yeah, structural cardiology is a little broader term. The number one thing we do is treat valve disease, but we can also treat any kind of structural defect of how the heart is put together. So we can fix holes in the heart, we can close holes, we can close pouches, things like that.
Is there anything else you'd like to add about heart valve disease during Heart Month?
The main thing is just that, the valve disease that we see comes with age mostly. Now, younger people can have heart disease too, but as the U.S. population, as the world population ages, we are seeing more and more patients. And I'll just go back to, our model of seeing patients together with a surgeon, deciding what's best for them, doing the right thing for the right patient. I think that means a lot.
I think that's great for our patients to know. Thank you for joining us during Heart Month, Dr. Chhatriwalla. We appreciate it.
You're welcome.
To learn more about our valve and structural heart programs, you can visit stlukeskc.org/valve. You can also stay up to date with all the latest health news and stories from St. Luke's at stlukeskc.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.